East Harerghe Zone Health Department, TBL, TB, HIV, and Drug Resistance TB Program Performance Report of 2014 and the first quarter of 2015. Unite to end TB. Presentation outline. Zonal background. Summary profile of healthy facilities. Objectives of targets to achieve during 2014 EFY. TB case finding and the TB treatment outcome. Community TB care or community TB CTBC and public-private mix implementation status. TB prevention therapy TBT. Drug resistance TB implementation status. TB HIV collaborative activities. Leprosy program implementation status. TB laboratory service implementation status. Program management, monitoring and evaluation. Major challenges, gaps in programmatic components. Way forward. Major activities planned for of 2015 EFY. Background information. Background, topography, location, eastern part of Ethiopia or Oromia. Distance 515 km far from Addis Ababa. Area 22,622.6 square kilometer. Administrative structure 20 rural waradas and 4 town. Kabale 586 and the health post is 562. East Harerghe population 4085775. Urban 412663 or 10.1%. And the rural 3673112 or 89.9%. Male 2083745 51%. Female 2002029 49%. Potential health coverage 85%. Warada with TBL focal person 24 including the town. Hello, Ligala. Bufata Faya, Ipatakadi, the Milama. Hospital Ligala or Ella Faya, Bishas de Milama. Clinica Idugala, the mission. Hospital, Yelkava, our Manenko Javi Clinic Water Yelkava, the Bajadim dead. Mapping of East Harerghe zonal administration. This is look like the map of East Harerghe zone. On the North Somali regional state. In the west, Diredawa. In the east, Diredawa. Somali Valley in the Somali region. West Harerghe, Diredawa. Administration map of East Harerghe zone. Vice versa, Ethiopia looks like this. East Harerghe zone administration. Warada 24, Kabale 586. Rural Warada 24, town 44, Magala 542, Badia. Male and the female percent and the number is look like this. Total population of the East Harerghe 21,400. Zonal health infrastructure buufata fayyaa 122, tajaajila fayyaa 562, hospitaala 8, private facility primary clinic 167, medium clinic 2, and it's like zonal human source, just like this. As a professional, is like diagnosis and treatment access for TB. Diagnosis access for TB, there are about 72 or 60% functional TB, AFB microscopy, 68 or 94% governmental, and 4 private facility. 5 gene expert sites in the zone, but 2 of them currently functional, 3 module failure, and 1 not calibrated software problem. Treatment process for TB. Currently, all public hospitals and health centers are involved in TB treatment, and 4 ppm 2 treatment initiative centers, TICs, and 8 treatment follow-up centers, TFCs, providing DRTB related service. All facilities networked with Harerghe Regional Laboratory. Zonal diagnosis and treatment access for TB, number of health facility and hospital, ppm. Zonal TB diagnosis access, number of health facility and hospitals, for 65%, 65% functional TB microscopy, 72 or 60% governmental functional TB microscopy, 4 private health facility, functional TB microscopy, functional gene expert, 5 hospitals. Zonal TB treatment access, number of facility, 100% all public hospitals and health centers, 4 ppm giving treatment, 2 TIC, Dadar and Garmulata General Hospital, 8 TFCC, providing DRTB related service or activities. TB diagnostic and treatment service delivery sites in East Harerghe zone 215. Health facility, government hospital, it looks like this. Epidemiology. Epidemiology, tuberculosis is major cause of morbidity and mortality in Ethiopia. The TB epidemiology in East Harerghe zone is almost similar to that of the regional and national. Tuberculosis prevention and control is among the top public health interventions priorities in East Harerghe zone. In East Harerghe zone, an estimated 5393 people fell ill with TB in the 2014 EC. Among estimated 99%, 5387 were diagnosed and treated for TB during this budget year. Out of total number of estimated around 1.01% were missed cases. Our estimated TB incidence was 132 over 100,000. Zonal TB program goal, objectives and targets for 2015 EFY. Goal to reduce TB morbidity, mortality, and improve health among the community through prevention and control of TB and Leprosy program. Objective to interrupt transmission of the infections, to reduce morbidity and mortality and disability, to prevent emergency and the spread of drug substance, reduce burden of TB among people living with HIV, reduce HIV burden among TB patients. Vision: Ethiopia free of TB, East Harerghe free of TB, zero disease and zero catastrophes. Goal to contribute to national ending of tuberculosis epidemic by 2035. Target to reduce TB disease by 95% by 2035. To out new cases by 90% by 2035. To ensure zero catastrophic cost due to TB. Major zonal targets. Prevention and control of TB case detection rate 90%, community-based TB care contribution 35%, treatment outcome cure rate 92%, success rate 95%, enrollment 100%, DRTB treatment success rate 75%. Leprosy prevention and control, leprosy case detection 85%, treatment outcome, leprosy treatment success rate 90 or greater than 90%, grade 2 disability less than 5%, TB HIV collaboration, screening of TB cases for HIV 100%, screening of HIV positive glands for TB 100%, ART and CPT initiation for HIV positive TB patient 100%, IPT initiation for new HIV patient 85%. Harerghe zone for priority intervention areas currently 2014. Addressing CAP population, cure rate and treatment success rate greater than 99 ppm and community-based TB care. Drug DSC, drug susceptibility, TB and RR or MDR case detection, TPT implementation, universal DSCT implementation, TB COVID-19 initiatives. Zonal TB case finding strategy. Strengthening regular TB screening integration at all outlet service area, passively patient-initiated way, OPD clients self-presented, active case finding, provider-initiated way, HIV chronic care unit, diabetic mellitus, DM care, chronic OPD, IMNC clinic, nutrition unit at hospital and health center, improve linkage with private facilities, conduct household and close contacts, presumptive TB referral from community through health stations, worker, strengthening communication between Border Health Center and hospital on diagnosed TB case referral. TB in key population, mapping key populations, prison, IDP, high-risk group, baseline assessment, sensitization, develop, coordinating committees, TB mass screening at concrete setting, KP several efforts were done on prison setting, entry mass TB screening and exit, university community, Aromaya University, school community, IDP community, health care worker screening, strengthening sample referral linkage with hospital with gene expert. The diagram looks like this. Summary of case detection in 2014, generally 5387 99.9 all forms of TB cases were detected in the 2014, which is greater than the same period of 21 85%, and it is show some improvement in CD case detection rate of all forms of TB. The proportion of childhood TB less than 5 years is 16%, which almost higher than proportion of the national child TB, 13%, indicating active transmission in the community. Of all TB cases, 2891, 53.7% are males, while 2496, 46.3% are females. Zonal TB notification rates is about 132 per 100,000. The proportion of new bacteriological confirmed pulmonary TB from all forms of TB cases detected was about 48%, which is somewhat greater than a proportion reported in the same period of 2013, 43%. Currently, proportion of bacteriological confirmed pulmonary TB is expected to increase as gene expert sites were increasing and different eligibility criteria for gene expert utilization have been included in the new TBL and the TB-HIV comprehensive guidelines. So overall proportion of the pulmonary TB from all forms of TB was about 75%. From a total cases of detected 5387 during the 2014 period, contribution of community-based TB care to zonal TB CF was 32%, 1691, which is consistent greater with the same period of 2013, 32% of contribution. ppm contribution to zonal case detection was only 53 or 534 or 10%, which is greater than the same period of 2013 contribution, which was 7.7%. Among 21 bacteriology confirmed TB cases enrolled in cohort 19, 27 or 96% was cured and the TB success rate was 20.02. In 99%, which is greater than the same period of 2013, and it is show some improvement because of increased dose and follow-up provision. Among 2616 clinical diagnosed TB cases enrolled in cohort 2592, 99.1% was complete rate, the treatment which is in line with the same period of 2013. Generally, 4692 all forms of TB cases were enrolled in cohort in the 2013. Among this rate, treatment failure rate. Among the 5387 all forms of TB cases detected in 21.4, 51.89 or 96% was screened for HIV, and the TB-HIV co-infection rate was 22 or 0.4%, which was low in compared with national prevalence. IPT coverage for new HIV positive patient was 90%. IPT coverage for under 5 years children was 94%. ART coverage for TB-HIV co-infection patient was 100%.